Hey, Dar, so talk to us. What's one piece of advice you can give us this Monday morning?
All right. So if you're not doing sleep apnea treatment in your office, I think you're unethically treating your patients or lack thereof. We look in the mouth as dentists and hygienists and dental assistants, and we are capable of identifying if someone has signs or patterns of sleep apnea or snoring issues. When I teach my courses on how to do sleep apnea implementation and screening and treatment and practices, people in the audience are shocked how many patients are walking in through the door. And as dentists, we see them 2, 3, 4 times a year. So it behooves us to be able to look in the mouth, look at the patient and go, hey, Michael, do you sleep well at night? Anyone tell you that you snore? Or do you feel tired throughout the day? And it's really our job because there's only really 3 major treatments to sleep and snoring. And that's a CPAP machine, which everybody loves, sarcastically speaking, an oral appliance that brings the jaw forward, and a couple different kinds of surgery. And guess who can only do the oral appliance? The dentist. So we are the only ones that can actually treat a medical disease called sleep apnea. So the ADA is pushing the screening to become mandatory, and I believe all dentists should definitely be doing this on a Monday morning.
Why do you feel dentists or practice owners aren't doing it?
I think it's a lack of implementation of systems, worrying about where do I send this home sleep study? Can I do it? The answer is yes. You're obligated to do it. If a patient has a diagnosis for sleep, there's one of the treatment modalities is an oral appliance as deemed by the American Medical Association for dentists to make. The hindrance here is the dentistry is easy to make the impression and the bite and the adjustments that I teach. It's super easy. It's as easy as doing sealants in dentistry. It's really the systems. And the system is, what do I do with the medical billing? I have my own medical billing company that I refer to. I never recommend anyone doing it in-house unless that's all you're doing. And then you can have your team dedicated to that. But you're busy doing dentistry, or your staff is busy sending out dental insurance claims, or remotely there's dental billing companies now. Why not have a medical billing company remotely do that? And at the end of the day, Mike, it's not just about medical billing. You can charge cash. We as dentists charge cash for Invisalign, for ortho, for implants, for $3, $4, $5, $6, $7,000 for these types of procedures. Why not $3,000 for an oral appliance?
You do seminars, right?
Correct. radseminar.com. I have a list of all the seminars that I have, and I also have a coaching program. So when someone takes my full day course, that's not it. I teach them how to implement systems. We do weekly meetings, 30 minutes a week for a total of 6 months to make sure that it's successful. Mike, the biggest thing here is we're saving lives. 12 to 15 years off your life if you have sleep apnea and you're not treated for it. 12 to 15 years, 5 times higher risk of cancer of any kind if you're not treated for sleep apnea. A University of Wisconsin study reported a few years ago. So not only are you saving lives, but also the offices that I train, about $250,000 the first year to their practice if they're open at least 3 days a week. That's a lot of good ROI and what we call ROL, or return on life.
I like that. So then, have you seen this, especially in your seminars or maybe just in general? Doctor goes, they get trained, they're hyped, they're excited to do this. And then it slowly starts dying down. The team's like, hey, it's slowing us down. We're not doing as great. We don't know what to do, right? And then it just ends there. And so that's the reason why they're saying, hey, we tried sleep apnea. We're trying it, but it just doesn't work in our community. Is that true?
Yeah, since 2014 was my first course. And what I used to do is just do courses. And then they would go home and on Monday, they would try to implement. Realistically, it was when we were doing follow-ups with these doctors from the medical billing company and the home sleep testing company to try to onboard them so they can refer home sleep tests to them and do the medical billing for them. About 15% of dentists would actually start doing this out of the people who came to the course. I believe without any arrogance, I have one of the best courses out there because it's real, it's easy, its implementation is easy. It's basically you come back on Monday and there's a patient that's upset and the staff doesn't show, the crown doesn't fix. So people get bottled up with general dentistry stuff. And that's why I created the coaching program. And there's nothing out there like it that really holds your hand after you do the instructional videos. Now you can do it on your own. It's 6 hours of video for the doctor, 25 minutes of video for staff and hygienists to be able to say, okay, now I have the information. So now it's about implementation. And just like any great athlete, Michael Jordan or Steph Curry or Kobe Bryant had coaches. Even though they shot the ball, they still had coaches reminding them to take 1,000 free throws every week. And it's the same thing, reminding you to do the screening, reminding you this is the home sleep test. What have you discovered? What troubleshooting have you had? When a patient says no to this or yes to this or has jaw problems or any sort of other issues like dry mouth, how do you resolve for that when we're in the mouthpiece? So there's a lot of little things that are in the video, but you kind of forget until we start playing the game. I push the doctors to play the game. When they see the outcomes coming and they get on, they call it cruise control. After 6 months, then they go month to month with me and I'm available for any more coaching on a monthly basis.
Nice. Okay. So where do you see when it comes to implementation, especially with sleep apnea, most drop the ball?
The most drop ball is just basically being, let's call it, not shy and opening your mouth. Elijah Desmond, my buddy and mastermind mentor, said to me one time, closed mouths don't get fed. So if you keep your mouth closed, you're not going to get the response that you want and help the humans out there that are truly suffering from being able to sleep next to someone, to snoring issues, to high blood pressure, to acid reflux, to cancer risks, to heart attack, stroke, depression, anxiety, mental health connections. And so we are shy sometimes to bring it up and say, hey, I see a little bit of scalloping on the side of the tongue, shows maybe some thrusting of the tongue when you're sleeping at night. Do you sleep okay, Mike? Do you feel like you get enough air? Do you wake up feeling refreshed? Are you tired throughout the day? Or I see, grinding of your lower front teeth. That's indicative of the jaw grinding forward at night when you sleep. That could mean that your breathing is altered and you're trying to do your own kind of CPR movement with your jaw, bringing your jaw forward. Your teeth are grinding on the front. Can I help you with your sleep? That's it. The answer is either a yes or a no. And we get rejected in dentistry and in life when we recommend other types of treatment modalities. And I kind of brush it off when it's like, okay, you don't want to do a crown. Okay, half the cusp is fractured, no pain yet. 9 out of 10 may say yes, one says no. But people are really suffering, energy levels being low, to sleeping in other bedrooms. This is a different beast of practice. And so if we can actually just screen them properly, which is the number one thing, open your mouth and then know who do you refer to if they don't have a sleep study, which I talk about all that. Hand it off to a home sleep testing company. No equipment to buy, nothing like that. It's just know the knowledge and execute. And so I think that's the problem, is just opening up the conversation, because you think someone's complaining about their finances or their work and this, and you're too shy to bring it up because you don't want to scare your patients away. There's a reason why I got into this, Mike, and I don't know if you know my story. I fell asleep at the wheel in 2009. I crashed my car into a tree not knowing I had sleep apnea. I wasn't overweight. So if someone were to look in my mouth and say, hey, Dar, how's your sleep? Are you feeling tired? But I'd be like, yeah, you know what, dentist? I actually am feeling a little bit more tired. Well, I can help you. Maybe you can do a home sleep test. You don't have to go to a lab anymore. And if I actually executed and said that, I may have not had that accident. What if I hit somebody? 4% of crashes occur because people fall asleep at the wheel. And it can happen to anyone, including our patients. So it behooves us to jump in and try to at least screen the patient to be able to see what's going on.
So screening the patient is like the best way to not just, I guess for like lack of a better word, sell it, but at the same time to bring awareness, to let them know, to say like, hey, we're not going to drop the ball here because your mouth is showing these symptoms. Does your life reflect that? And if they're like, you know what? Yeah, I am not sleeping well. I'm not doing that. Now's the point where we do what? We can just, let's do a test or...
The screening is there, but also like when people are a part of my program, we have emails ready to go that sends through the software program like Dental Intel or Weave. When they confirm their appointments, they also have weekly emails that say, did you know snoring can affect not only your bed partner, but also your bed partner's life expectancy? The person who sleeps next to a snorer is not sleeping well and waking up a bunch of times. That's going to affect their overall health. Come in and see Dr. Rad for a complimentary consult. He now treats snoring and sleep apnea. Next email. Congratulations, Dr. Rad, for finishing the course and being able to treat snoring and sleep apnea with an oral appliance. For those of you who have been tested and don't like your CPAP machine or haven't been home sleep tested at all, come in and have Dr. Rad do a complimentary consult for you. So educating your patients before they even come in through emails once every other week or once a week, giving them information like the 5 times high risk of cancer, come on in, let's do an evaluation, or bring it up at your next checkup appointment. These are ways to be able to touch your patients. A lot of these patients have no idea that an oral appliance is a solution, let alone that you're capable of doing it.
Have you seen this? People were to say like, I'd rather snore a little bit more than have that big machine.
Oh, yeah, absolutely. It's like, I'm not going to wear that thing. But also, Mike, think about it. If you're single and you're dating, let's be adults for a minute, you get intimate, putting that mask on, let alone traveling with that to go to your partner's home. It's so much easier to carry your mouthpiece with you to at least reduce the snoring, if not eliminate it, depending on how severe. 80% of patients are mild to moderate sleep apnea, which the mouthpiece works brilliantly for them. And then even severe patients, we can get their scores down to a mild to moderate in most cases. And so it's not for everyone, but CPAP's not for everyone. You know, if it's a mild case, I have patients, I'm like, why'd the medical doctor even give you a CPAP when your apnea is so mild? And they come in, mouthpiece, one shot, put it in, they go home, they're like, oh my God, this is so much easier than wearing the CPAP machine. Travel purposes, camping, on an airplane, hotels, keeping the machine clean. That's it. You've got nothing else. You've got the mouthpiece, you've got the CPAP, and the surgery is very invasive. Then you have to pretty much be very severe to end up having any sort of surgery called Inspire, which is a hypoglossal nerve stimulation device that's put onto your chest muscle there. And then there's also some rotor-rooter of your throat called the triple UP, where they remove the tonsils, the uvula. I mean, it's not easy for the surgical part as well.
That's a good way to also educate the patient is like, hey man, you want to go camping? So much, I guess we can talk about this, but any final pieces of advice that you'd like to give to our audience?
First thing is get educated, have the ammunition to understand what to look for when you look in the mouth and the medical history. And then all of a sudden you see like these patients coming in with class 5 lesions near the gum line, the little abrasions or acid reflux, and you see dentin exposure. And it's not just dentistry now. We need to see what the root cause is. And part of the root cause, clenching and grinding of your teeth. Over 50% of people who grind their teeth is because they have a fight or flight response because they're not getting enough oxygen. You open up the airway, their TMJ symptoms actually get better. And so educate yourself. Once you get educated and you understand how to do this, the rest is implementation. I've helped over 3,000 dental offices now. I'm open to help more just because if I can help one dentist and he or she can help dozens, if not hundreds of their patients, we all come together, we sleep better, we're not as grumpy, we're more kind to each other in the mornings and throughout the day, and we have more energy for our loved ones. We're working out at our work, being more focused and alert. It's our duty as dentists to be able to do this. And it also makes some good money too, if that's one of your motivating factor.
Nice. Awesome, Dar. I appreciate your time. And if anyone has further questions, you can definitely find them on the Dental Marketer Society Facebook group, or where can they reach out to you directly?
If you go to radseminar.com, radseminar.com, there's a chat there that you can throw a message in that comes directly to my cell phone. It also shows my virtual courses as well if you want to do a la carte stuff. I also do webinars once a month for the masses to come on, just get some new information and updates. So I'd love to have you guys on, and then we'll do a call together once you send me a message, and I can show everyone how to be able to do this in their own practice. Whatever I do for the 6 months, I guarantee that the investment that the dentist puts in, they get it back. I've never had to give a full refund or any refund whatsoever to any dentist out there. That's how confident we are that it works and it's profitable.
Thank you so much, Dar, for being with us. It's been a pleasure. And thank you for being with me on this Monday morning episode.
Thank you, guys.